Are you an international medical graduate dreaming to practice medicine in Canada? You are on the right place. Hello friends, welcome back to my channel. Today I am going to discuss how you can pursue your dream to start practicing in medicine in Canada and how to integrate into the Canadian healthcare system if you are an internationally trained physician or international medical graduate. There are multiple pathways in which few of them are residencies as well as few of them are assessment pathways in different provinces in Canada. Number one, CARMS, which is very famous, and anybody who had completed their medical degree and their medical college is coming into the world website, then you are eligible for the CARMS application and you can try to get into the residency. The minimum residency for the family medicine is 2 years. Second program is the practice ready assessment program. This program is not designed to train you, but it will assess you and do an assessment of usually 12 weeks, and there are 9 provinces at the moment who are providing PRA programs, each of them having a different criteria. Today I am not focusing on that, but there is a third program which is called the MLPIMG in Manitoba. So MLPIMG is basically a medical licensure program for internationally medical graduates, and this program is designed by University of Manitoba. It is for those people who are internationally educated family physicians, so they can get a 1 year of training and after that they can start practicing as a family physician in Manitoba. Let's start our main topic today. So as I mentioned that my topic of discussion today is MLPIMG program. It is a 13 4 weeks postgraduate medical education rotations training in Winnipeg. What I mean by that is you have a 1 year and 4 weeks to train yourself into different rotations in different hospitals in Winnipeg, in which it includes emergency, internal medicine, pediatrics, gynae ops, addiction, psychiatry, and they will try to give you the training as much as possible to get ready into the Canadian healthcare system and how you can provide care once you finish your training. So once the training is successfully completed, then the IMGs, which will now call as a physician, will be working in the rural and the underserved areas of Manitoba for return of service for at least 4 years, and after that they will be obtaining their medical licensure as a family physician. So what this program is designed for, the 1 year is basically the training in which you will be in the Winnipeg and you are getting into the different rotations to get the exposure of all these fields which can cover the family medicine. After that you have to be into the rural community of Manitoba to perform your return of service, which is around 4 years, and after that 4 years you will become an independent physician license. So in total you will be staying in Manitoba for 5 years, and then you will become an independent physician and you can stay wherever you want in Manitoba as well as in whole Canada. So this program will ask you to invest your 5 years in Manitoba to become a full family physician. Many of you, if not aware about return of service, there might be a questions running in your mind. Why I'll be working in Manitoba for return of service, which rural areas I'll be staying for at least 4 years, what are the regional health authorities in Manitoba, who is sponsoring me, what is the sponsor interview. So in briefly I will describe you what's the return of services and what are the regional authorities which are divided in the whole province, and they are taking care of different regions of Manitoba. So as you see, this is the map of the Manitoba, and if you see the different colors and different regions, so these are all the regional health authorities. The topmost is the northern, which is the most biggest one, and it has a lot of different spaces where the small communities need physicians. So if you are successful MLPIMG candidate, you will be placed somewhere here. And there are 3 others which you see: Interlake, Southern, and Parity. Nobody is going to work in the Winnipeg health region as a return of service, but all the 4 in the list highlighted, any of this region you will be staying for 4 years. It depends which region is sponsoring you and which region is taking you as their physician for next 4 years at least. Let's come back to the application process of MLPIMG. as we all know, the application is going on and the deadline is coming soon. So I'll be briefly describing what are the criteria which where you can be eligible to get into the MLPIMG application. Number one, residency status. Regarding Canada, it's not about Manitoba, it's about Canada. Are you a Canadian citizen or a permanent resident? Then yes, of course you can apply for MLPIMG program. But if you are on visitor visa or work visa, they don't allow you because you are not eligible for that criteria. Preference will be given to established resident of province of Manitoba. This is a very bonus point for those who do have the residency, who are staying into the Manitoba, who are the resident of Manitoba for short or long time, it does not matter. But if your address is coming from Manitoba, it's very favorable in your situation that they might pick you from other peoples who are from other provinces or other countries applying for the same program. But this is not the one thing which is 100% reliable. It's just the bonus for you. So don't be discouraged if you are not having a address in Manitoba or you are not living in Manitoba. I would highlight that you should apply for it. Second thing, medical qualifications. That means they are talking about the exams. There are two exams. Any one of them will take you to the eligibility criteria. Either it's a NACOSCI or it's a QE1. As QE1 is discontinued for last few years, but if you have finished your NACOSCI and you pass your NACOSCI, you can still apply for this program. Those of you who did not have the QE1 pass or did not appear in QE1, don't feel bad. You can still apply for this program unless you don't have NACOSCI, then you are not. But if you have NACOSCI finished, your QE1 is still pending, you can still go for this program. So if you're coming into that criteria, you're good to go for the application. Third is the most important, is the experience. What they are asking for is, they are asking if you have at least 1 year of independent practice experience in your home country as a general practice, as a family medicine, as a primary care. If you are in somewhere in a country where you have practiced as an independent physician for 1 year, 2 years, or 3 years, you can highlight yourself as an independent general physician, independent general practice, independent family medicine, independent primary care provider. Anything in your resume that will make you eligible for this one. If you were a medical officer over there, because in some countries we do call medical officer, so try to modify the name as an independent general physician, because medical officer in Canada is way different than a physician. So it's just the way of name, but the duties and the responsibilities were always the same. So you can provide yourself to say that, okay, I'm independent general physician. Independent means you are not in any kind of training in your home country. You are taking care of patients by your own without any supervisions. Either it's a small clinic, either it's a big hospital, either it's any department, but you were working in a primary care. What does the primary care means? You were seeing patients of all ages, of all categories, and all types of conditions. So it's not something you would say, okay, I was working in one specialty. That would not count as a independent practice. Currency of practice is very important. It does not matter what your age is, because I have seen so many people in successful IMG candidates, they are in the program and they are having variations in their age. So don't worry about your age. But as far as your currency of practice is within 5 years from the day the application started, that is the 1st August 2024. So if your independent practice was, if you go back and it's within the 5 years, then you are good to go. But if you have been out of the independent practice for many years, more than 5 years, then you will need to have a minimum of consecutive 12 months of independent clinical practice in your home country. So either way, you need to have a 12 months of independent practice in your country, which should be within 5 years, the day your application is just starting. Those of you who are working as a registered clinical assistant in Manitoba, as a licensed clinical assistant in Manitoba, that means you have the license from CPSM, you guys are exempted from getting the requirement of currency of practice. You can directly go into the appendix of the application package. You can fill out that package. You can ask your supervisor to fill out the form, and then you don't need to show your independent practice. You are still eligible for MLPIMG. Now, after once you have been selected for MLPIMG requirement, you submitted your application, you got your first interview, you pass your first interview, and then you are shortlisted for the second interview. Then they will be asking you if you are eligible to get the resident class license. What does that means is, that means the CPSM, which is the College of Physician and Surgeons of Manitoba, will be requiring some of the things from you in which they can provide you a resident class license, and this license will only be valid until your training finishes. Usually the training starts on 1st of July and it's finished on 30th of June of next year. So this is the 1 year period where your resident class license will be eligible, and you can practice in a hospital as a post graduation training one. What are the requirements which you have to look? Number one thing, you have to provide the evidence of satisfactory completion of training in family medicine acceptable in to the College of Physicians and Surgeons of Manitoba. That means, that is called talking about your internship, you can call it house job, you can call it the training which you do after you complete your medical degree. It is usually 1 year, so they are looking for that one, and it is satisfactory. They haven't mentioned what kind of rotations they are looking for, but what generally things they are looking for is general medicine 8 weeks, general surgery 8 weeks, pediatrics 8 weeks, gynae and ops 8 weeks. So all of these 4 rotations should be having at least 8 weeks. That will help you to get the CPSM resident class license, and it is approved by a registrar. That means you are working in a hospital or in a teaching hospital, took place in one or more healthcare facility recognized by a national post graduation training authority. It does not matter if you have done your general medicine in one hospital and then you went to for next 8 months or 9 months into a different hospital, but if you have the certifications which are source verified from Physician Apply, you can still be coming into the satisfactory completion of your training. Third thing is accredited of the National Post Graduation Training Authority or was credited at the time of training was completed. This is talking about when you are having a teaching hospital, which we usually all of us complete after our completing of degree, medical degree. Fourth thing which is mentioned here is the language proficiency. We all coming from a country where English is not our first language, then we have to prove that our English is good enough to be into the system. So they have given a multiple choice in which any one of them you can choose and complete your English language proficiency. I would highlight, if you haven't done your OET or any kind of exam for English, just do it now, because it will take around few days to come back the results, and once the results is here, you can still be eligible to get the resident class if you are shortlisted applicant. This slide will show you what are the things you need to get for to prove yourself that English language proficiency exam. Any one of this you are going to take. You don't have to take all of them. Either you are going for the academic IELTS, then you have to take 7 in each component. That means 4 components into the same setting. That means if you are going for an exam today, then all the things which you have done today, and if your speaking is tomorrow or day after tomorrow, then the certificate of the IELTS will show that all of these were done in same setting. That means your each score should be 7 at least, minimum 7. Or you can go for OET medicine. OET medicine is kind of occupational English test in which you need minimum of B grade in all the 4 things into the same settings as I mentioned for IELTS. Or you can go for Canadian English Language Proficiency Index program, which is the journal one, which is very famous nowadays. You can look into it, what are the criteria and everything, but for that you need a minimum of 9 score in each of the 4 skills in the same setting. So what are the 4 skills? Speaking, reading, writing, and listening. So these are the 4 things in all of these components, but you have to take any one of them and you have to get the minimum of score what they are looking for. There are few countries which are exempted from for taking of any of this exam. If your medical degree is coming from any of this country, then you don't need to take an English exam. So I have just highlighted the countries which are mentioned. You can also look into the website what are the countries and if you are eligible to exempt or not. This slide is talking about family medicine practice as an unlimited license when you are going to the return of service. So this slide is all about those people who have successfully completed their MLPIMG training program. Now they are going to the CPSM again to ask for the provisional registered family practice limited license. Family practice limited license means your license will be eligible to that return of service where you will be working or where your region is giving you a location. So I'm not going to detail about this one, but if you want to read more about it, you can read the whole slide, or you can go into the CPSM website and find out the family practice limited license, and you will find out all the criteria. So this is all about after completing the 1 year of your training, when your resident class license will be expired, then you have apply for this license. Now, as I mentioned, what is the residence, what are the criteria where you can prove that you are, what is the status of yours in Canada? If you have a Canadian citizen or permanent resident, either way you can show from two ways. Number one, you must provide the proof of your Canadian citizenship or permanent resident status by sharing through a physician apply account with the University of Manitoba International Medical Graduate and Clinical Assessment Program. If you have given your Canadian passport to physicianapply.ca account, or you have given your permanent residency card during the source verification, then you are good to go to share those things. But as of my knowledge, many of us have given our passport which is from home country, so that is not applicable. So what you can do is, instead of sharing your passport from them, you can also provide a notarized copy of your permanent residency card photocopy or the citizenship passport. So any of this is available, and your physician apply account is having your home country passport, you can just take a photocopy, do a notarize of wherever you are, and send it with the application package. Second number is proof of residency in Manitoba. As I mentioned, this is the bonus point for those who are living in Manitoba, who do have the address of Manitoba, or who are working in Manitoba, but you need to provide any kind of proof. You cannot just write the address. So either you go for the Manitoba health card or the driver's license notarizing, or the third way around is, if you came recently and you don't have the driver's license because you are still in the process, or you don't have the health card because it takes a lot of time, so you can go to the MPI office and ask them to give you an identification card. Identification card is same as driver's license, but it is for those people who cannot be eligible for driver's license, let's suppose less than 18, but you are still be eligible to get the identification card, and that will help you to prove that you are residing in Manitoba. This is not written anywhere. If you want to make sure, you can even email it, but this is my own story. When I came here, I was in MLPIMG applying for this one. I did not have any kind of driver's license or health card, so I got the identification card, I notarized it, I sent it to the application, and they accepted me, and they interviewed me for my first and second interview, and after that I got my MLPIMG program. So this is the true story. You can still confirm by emailing them to make sure that you are on the right track. One important question is, how do you share your documents and your profile information to the CPSM through physician apply? It's not just the CPSM, you have to give it to the University of Manitoba, because they will be looking at your documents from the physician apply account along with your application package. So if you go on your account, you will see on the right hand side there is a name called shared, which I highlighted it here, and then you have to go onto this page. When you are going on this page, you can choose University of Manitoba International Medical Graduate and Clinical Assessment Program, and when you click on this one, you will go on next, and they will give you a couple of your documents which are already source verified from your account, and you have to choose all of them and send next. There is no fees for sharing the document. If you want to share your documents with the CPSM, that's still acceptable. There is no harm in that. But the one which is highlighted here, you make sure that you click this highlighted part, because this is the one where MLPIMG admin peoples will be taking care of your documents which are shared through physician apply, and they can only have the access through this one. They cannot have the access from CPSM, because CPSM is a different organization. MLPIMG program is offered by a different university, so they don't have similarities when they are trying to see your documents. So make sure you choose this one for MLPIMG, and you can also choose this one if you want. There is no harm in that. Last but not the least, what's the how to submit your application. Once you get the application package, you fill out all the details, you put your personal statement, you ask your referee to give you the reference letters, you had your resume ready, you had your notarized documents ready, then you make one PDF. Then you have to make a one PDF. There are multiple free online websites on which you can make your PDF. You have to arrange your PDF and send on this email address, or you can send it by mail to this address. If you are sending your by email, I would highly recommend to send it 1 or 2 days before deadline, because they will send you a confirmation that they have received your application. But if you're sending it by mail, make sure you give at least 1 week of buffer, because if they don't receive it by 1st of September, it would be unlikely that your application will be accepted, or they will still take it. So just give a buffer time. Don't wait for the last day for any of these options. Now I'm going to discuss about the application package and how can you navigate to get the application package. So if you are going on Google, you just have to write MLPIMGs, and when you write MLPIMG, you will get that first link. When you go on the first link, you will be getting this one, and in this one, when you come down, then you will figure out where the application is. This is the part where you might see what are the rotations you will be getting in a 1 year program. So that's emergency, family medicine, gynae, ops, internal, pediatric, psychiatry, and some of the addictions which is attached with the family medicine. And when you come down, you will get the apply now. When you click on this apply now, you will be coming to this package. So what this package is all about, let's talk about this package. So this package is a multiple pages, 23 pages. You have to read all of them very carefully. I'm not going to read each of them, but one thing is, if you see this highlight, this red letters, they are saying if you successfully in obtaining a sponsorship and admission to the program, candidate must understand that they will need to withdraw from the CARMS process prior to the rank list due date. The reason they are talking about is, if you are applying for CARMS, if you're already, and you are also applying for MLPIMG, and you got your MLPIMG and you are looking forward to enroll yourself into that, you have to withdraw your application from the CARMS. They will be emailing you definitely, but you cannot book both of the spaces. You can decide if your CARMS results come first, if your CARMS results comes next, but you cannot take both of those spots. So that's the only thing. You don't have to worry about it. Just go for the both application if you are eligible. Once you get the offer letter from both of them, then you will have enough time to decide and just withdraw one of the applications. This is all the eligibility criteria. The first interview usually comes in the end of the year, that means around December or end of November somewhere in 2024. And the sponsor interview, which I was talking about, return of service regional authorities, so they will be taking care of your interview in start of 2025. So on that interview, there will be the multiple peoples of each region, and they will be asking you questions to see where you can fit, you are the best fit for them into their region or no. And then your MLPIMG training will start in July. This is the orientation, which is the whole month of June. It's usually virtual this year, but we don't know the next year. This is all the criteria which you have to look after. And once you are going down, you will see that you have an application which is in which you have to put all your names and everything. I will highly recommend, once you are submitting your application, make sure you tick all of these boxes. You have to provide 3 reference letters, and you have to provide your CV, as well as you have to provide your notarized documents. That suppose you are residing in Manitoba, or you are a Canadian PR or citizen, but you don't have a physician apply. So this is all the things which you need to put. You have to put your stuff. If you haven't passed, then you can say that I'm applying on this month, and then you just have to blank it. You have to provide all the things here. This is the number which is available on your physician apply account. This is the number which is available on a physician apply account. Make sure you write it that perfectly, otherwise they will not be able to see your shared documents. So this is very important. Recheck it before you submit it. Then you will come here down, they will ask you about your country of licensure. That means for which license you are having. Let's suppose if you are somewhere from your country, they have an independent unrestricted license, you can just write that one. These are all the trainings. That means your internship, or that means call your house job, that can call your training after your degree. So you have to write it down, mention it here, and in this format, where when you started, when you finished, and which medical school or the hospital it was. It is the teaching hospital usually, so you have to write that part. And when you come down, this is so this is the part where you have to provide your independent practice. This is very important for those who are not working as a clinical assistant. You have to provide which was your location, briefly describe your practice there, especially describe what kind of peoples you're seeing, which ages, because you are providing everything in your resume, but they still want to see what's your highlighted part in the job. Okay, and you can provide the contact information of the place where you are working. And this is the telemedicine practice only. If you haven't done any, you can leave it, but you have some kind of telemedicine practice, you can still put your information here. This is the personal statement. So maximum is 1000 word. When I was applying, I used 999 words to get my personal statement. So don't think about either you go for 500, either you go for 900, either you go for 700. It really depends on your own personal statement. You can choose whatever you want, but don't exceed above 1000. And you can copy and paste your whole personal statement here, or if you want to put it as separate file, you can just write it down. I attached a separate file for my personal letter and include it in this application package. That's it. After that, you have to write your current reference letters, because you have to provide 3 reference letters, so you have to provide the details of the 3 reference letter. Try to put the maximum information you can, especially fax number, telephone, email address. There is a one common questions from where I can get the reference letter. Number 1, the current job where you are doing, if you have any, inside the Canada, outside Canada, doesn't matter, because this is the way they will see you, what is your recent experience and how you are being into that position. Number 2 is, if you have an experience, independent experience, you are trying to show it, just ask your manager, ask your hospital dean, ask your department dean, anybody who is the manager but not your supervisor. They can give you a reference letter. That's the second thing. Third thing, if you don't have any job other than these ones and you are still looking to get a reference letter, you can get from somewhere where you have worked in past but not the clinical one. If you have a clinical experience and you can get the references from clinical, that's the best shot. But if you don't, still the reference letter counts from anywhere which way you want to put. And then you have to come down. These are the signatures which you can ask anyone, your colleague, your neighbor, or someone that can say that okay, you are applying for this one. And then you come down, and this is the appendix for only for those who are applying for clinical assistant in Manitoba. So make sure you put your information here, those people who are getting a clinical assistant job or doing their clinical assistant job in Manitoba. And this is the one which your current supervisor or the supervisor where you're working, they need to put it. Level achieved, it is the competency levels. If you are unaware of competencies level, you can ask your CPSM where you have done your clinical assistant license, what are the competencies level, and you can ask your supervisor at which level they think you are, and they can put it here. This is the CV template. I would highly recommend that you follow this template, because this is the first time they have given you the template. At the time when we were applying, there was no template, so we used to have our own formats. But if this is the template, make sure you use this template to put yourself so they can see and clearly understands what your resume looks like. You can add on stuff, that's not a problem, but make sure your all the headings and everything comes into this one. And this is very important that they have mentioned like this one, because they are looking if you are if you have done it. Instead of saying language proficiency test and this, you can choose one of them wherever you have done, and then you can provide this one. And apart from that, your certifications, your ACLS, BLS, PALS, anything which you have done, you can provide it here. And your clinical experiences, usually the clinical experiences in which you will provide independent practice, clinical assistant, Canadian clinical experience or something. Electives is something where you have done just an observership or electives, and these are the languages and everything. And this is the reference letter. This time it's very new and it's very different than the traditional ones. So you need to provide your supervisor this reference letter. You can detach from here, or you can save these pages and then make a copy and then send it to your referee, and they have to fill out all the things here, and then once they finished it, you can reattach it to your application. So these are all the things which I have tried my best to cover in this video. But if you have any question, just leave a comment below. I will try my best to get back to you as soon as I can. And if you have any confusion, or is there anything which I haven't covered, please let me know so I can make another video. All of my experience which I have shared today, this is the one of the successful story of my own. I got an MLPIMG program. I was into this program, so I believe like my personal experience was giving me an encouragement so I can help the other international medical graduates. Thank you so much. Have a great day and see you in next video.